Hi, I'm Tom from menshealth.physio and consulting at a Target Physio here in Brisbane. I've been asked to provide a quick video regarding how men can activate their pelvic floor muscles in preparation for surgery for prostate cancer. Before we dive into how to actually activate the pelvic floor, I thought I'd go to it quickly and show you a diagram of your pelvic floor muscles and how each muscle contributes to improving prostatectomy incontinence. Okay, so here we can see a diagram of the male pelvic floor. So what we're looking at here is looking sideways at the body. So we've got the penis out here, the rectum at the back here, tailbone through here, scrotum, bladder up above, and the prostate and seminal vessels here. When we are talking about post-prostatectomy incontinence, the main two muscles we're trying to activate is this striated urethral sphincter muscle, which pushes across through here, and bulbocavernosus, which pushes up through the top here. Our larger bum muscle is known as puborectalis, and it slings around the rectum and comes across to the tailbone, or the pubic bone at the front. From tailbone to pubic bone is where it lies. This internal urethral sphincter, it's a smooth muscle which controls most of our continence function prior to surgery. As we can see here is the prostate, which is removed. And then during that process, we get a bit of disruption to the smooth muscle of the internal urethral sphincter, as well as smooth muscle in and around the urethra as well. So our strongest smooth muscle that we can activate ourselves is our striated urethral sphincter. And that's where most of our research and training is aimed at, getting this one here to push across here and bulbocavernosus to push up and across this way. How do we activate these two muscles predominantly without getting the puborectalis involved? Some studies from the University of Queensland by Paul Hodges and Ryan Stafford showed that some of the cues best used include trying to retract the penis, or shorten the penis. So if we're thinking around here where the penis is at the body, we're trying to draw back in through there, which helps to activate these two. The other most commonly used contraction method is thinking about trying to lift the scrotum up, which can also be used to try and activate these two muscles through here. We don't try and activate the bum muscles anymore, so lots of YouTube clips will show and discuss things like trying to hold in a fart, trying to stop a bowel motion. All of those kind of contractions, they don't seem to be nearly as effective as trying to target these ones at the front. So next up, I'm going to just show you how we can start off doing this in lying and then also in standing. So we want to be able to do it in standing to withhold, to help hold in urine and get to the toilet and void in the toilet. So now that we've had a more in-depth look at our pelvic floor muscles, how do we go about activating them? As I alluded to just before with the diagram, we want to think about trying to shorten the penis or retract the penis. So we're thinking down where the base of the penis is at the body, and we're trying to gently, slowly and softly to start off with, gently draw in through there. In doing so, our tummy muscles are relaxed, our bum muscles are not kicking in, and it's a very soft and subtle contraction. A lot of men often will go too hard and too fast, and that will then activate that larger bum muscle, which is the muscle we're not trying to target. So it's very important to keep it very soft to begin with. You're not going to feel a massive amount of movement down there. The sensation we're trying to feel is just of a muscle just gently tensing up. So there's not a whole lot of movement. If you're standing at home in front of a mirror and you perform this exercise, you should be able to see the penis retract just a little bit in front of you. So to start off with, often I'll have men lying down. So lying down with their legs bent up. Arms can be on the tummy just to feel that their muscles are relaxed. So we've got the tummy muscles relaxed, bum nice and relaxed. And lying here, we just gently think about trying to shorten the penis. If we get some sensation with that, fantastic. The other cue that we know that also works quite well for men is trying to lift the scrotum up. So if we're thinking about walking into some cold water and at the last second we're trying to lift up the scrotum, that is another contraction that we can also use, or another cue I should say rather. So we're trying to play around with both of them. Either one will be effective, provided that we feel it just at the front of the pelvis and not around the back passage. After this, we're now going to go into some standing exercises. So once we've mastered this contraction, we can feel it working nicely. We can do it in the mirror or feel just behind the scrotum in the shower, for example, and feel a bit of tensing up down there. We can then go into standing and doing some more functional exercises in terms of standing up, doing a few squats and calf raises, and we'll now go and show you those as well. Now that we've looked at activating our pelvic floor muscles lying down, it's really important to prepare ourselves for after surgery. So we know that for most men, when they're sitting down or lying down, they don't leak that much urine. It is more a stress incontinence basis when they are up about and moving and things like getting out of a chair. So we just practice the basic contraction before lying down of trying to shorten the penis. And we want to try and do the same thing with functional movements. So for example, standing and can be done with an empty or a full bladder. So if I'm standing here and we're thinking about gently shortening the penis, and as we described before, you won't be able to see or know that I'm doing it, and that's a sign of a good contraction. We don't want to see the tummy muscles bulging out or tensing through the bum muscles when we activate the pelvic floor. From here, we can then go on to things like trying to practice shortening the penis, holding the contraction and doing some calf raises, or again, shortening the penis and doing some little gentle squats, for example. These are just a few examples of ways that we can functionally activate our pelvic floor in preparation for surgery. I hope you've enjoyed this video, and if you have any further questions or concerns, you can reach me at menshealth.physio. Thank you.